Well, good morning and welcome to the Talk at 10. We are live on Facebook and we're going to take a moment to talk about the functional medicine patient because functional medicine patients typically they're different than the other types of patients. And my wife is actually going to hop on here in a minute and she's going to tell the difference between what she kind of sees in the hospital and actually what we see in the office here. And you have to remember that we qualify patients. Um, if we don't see certain things, we won't take you or take someone as a functional medicine patient because it takes it takes work. And so that person that is willing to work is the person that we bring on because she and I are just guides. We just help people, show people the best practices right now, what we're seeing. My shtick is to get in here and to guide people through what we see is the most effective, and every patient is different. And my job is to read the research and to do it. Hello to those of you who have joined us. Pop in and say hello. And so while I wait for Jessica to hop in here, I am going to type in here and put my email on here. So feel free if you need to or want to drop me a line and we will get you help. Had to think of the super long URL. Good morning, Kathy. And Jessica's actually headed your way. I'm waiting for her to pop in here on the screen. But actually, if you wanted to add in, Kathy, type something up as to you missed the beginning where I was discussing the functional medicines patient's kind of mindset. This is a patient who does work on their own, is willing to do work, and then my job as a doctor is to help guide you to, this is what the research says, this is what we're going to try, this is how long we're going to try it, and then we do an assessment. We start to turn around and say, okay, did that work? What do we need to tweak? So feel free to chime in on what your experiences have been. And we are still waiting on Jessica to pop in. Good morning, Tina. And the office is getting ready to open. I generally do this early on in the morning on Thursdays. This is when I get to work on the practice and not in the practice. So I'm going to take another moment while we wait to say my journey through functional medicine started probably as far back as 2012. I knew there was something missing. And so that's how much work I have put into this. Not only to talk about myself, but to help others, because that's what I love to do, is help others. That's my job as a doctor. It's to be a servant to others, to help them become as healthy as they can be. Kathy added in here. I'm going to show this on the screen. So it's been good. Sometimes I get impatient, and one thing, I want things to happen faster than my body allows, but it's a very good program. And so when we look at that, there are a couple key things there. Is we don't get this way overnight. We don't get out of it overnight. And that's the same with me. I'm still getting ready to do my second microbiome test on myself. I see that my lipids are going the right way, so I'll be going through the entire front end of the lipids and the labs, looking at my labs that were off and making sure that I'm doing this. And that's a continual digging. That's a continual process. Because last few weeks I've had a couple of beers with the guys, and I have done things that aren't necessarily right. And that's the mindset of a functional medicine patient. And so the functional medicine patient really doesn't give up, because we know there's an answer. We just don't have it yet. And so we start to dig away and figure out. So, one of the first things for me was my lipids. And now with the lipids, I turn around and I have to get the, it looks like Jessica's having a problem with her email. So I got to resend this. So we sit there and we turn around and we do something else, or I do some reading, or I do some research. And there she is. Morning, hon. Uh-oh, can you hear me? Oh, she froze. I will remove her. I have the power. But that is what it's all about. Oh, there she is. And so, functional medicine is not for the patient that comes in that says, hey, you need to fix me. No, functional medicine is the patient that comes in and says, I've tried all of this stuff and none of it has worked. And now I need to do something different to get better. Can you hear me, Jessica? We see you. All right. So go ahead and tell us your experience with the difference in the functional medicine patients and the patients that you see at like the hospital and stuff.
Well, our patients at the hospital are just non-compliant. That's the gist of it. Functional medicine patients usually are more interested in driving their own care, and usually will come around to understanding that they're the ones that are responsible for doing the work and don't expect a pill to do it.
And that's kind of where we're at with our own health, trying to, this is a journey we are all on, but we want to control our health. I did not want to take a statin to drop my cholesterol. I didn't want to take glipizide to drop my blood sugar. And we've both taken care of that. We've both gotten rid of our blood sugar issues. And now we're on to the next layer of the onion, don't you think?
Yeah. Hey, I need to put an address in my phone. So how do I do
Uh-oh.
that? It'll keep you.
I have no idea.
Well, if I lose you, then just know I'm coming right back.
Okay. So while she is out and about and doing important stuff, taking care of Gracie, and she's going to go shopping for olive oil here in just a little bit, we are, yeah, and that's something else. A functional medicine patient, the profile of the patient is the person that wants to learn these things. Why do we eat olive oil, and why do we spend extra money to buy good olive oils? And why am I that nerd that's in Kroger's that is that's sitting there reading reviews on olive oils to see what's going on? And I just bought olive oil at Kroger that the company was so fed up with. Company was so fed up with all the bad olive oils that you can now go from olive to oil. You can trace it all the way back to where they grew the olive And so you know that it is authentic olive oil. I'm going to answer a question over here. And I mean, it is work, but it's worth it. And that's the thing is it is work. It is worth it. It's like anything in life that's worth having. You know, if you buy a really nice car, it's going to require maintenance or it'll fall apart. I don't care how expensive or how nice or how fancy or whatever it is, it requires maintenance. Your health requires maintenance. And no, Kathleen, uh, I can tell that you don't want a pill to fix you, and you've tried lots of things, and we are going to absolutely start to turn that around for you. All right. And Miss Jessica is back. So you had a lot to say. You go ahead and say what you want to say.
Oh, well, you're asking me. So I get irritated. I'm driving, so if I it's funny. I have no idea where I get irritated with my patients because they all want to have somebody do the work for them. So they want pill, pill, and they want to eat candy bars and orange juice and chocolate milk. They don't want to be responsible for their own actions. So most of them are always saying, I just don't know why this is happening to me. When or I hope I can get to the doctor so they can fix this. And they actually have the power to fix it themselves.
Well, and what's funny about that is we know that the root of the word doctor is teacher. The doctor's not here to fix, the doctor is here to teach. This is what's going wrong. Now, we have the ability, if you have overgrowth, to give you things to kill off things and to bind them and to get them out and to help you that way. That's our part as healer. But that's, it's just, there's nobody that is going to fix you but you. The doctors are just here to help show you the way.
Well, they're usually symptom control. In my world, it's symptom control.
Well, that's what, you know, modern medicine. And we saw we're actually going to do a screening of the movie called Escape Fire. So, Kathy, you're local. Sorry, Kathleen, you're not. But if you have Amazon Prime, you can watch the movie called Escape Fire on Amazon Prime. We're going to offer an opportunity to our local patients to come in, sit down for an evening, watch a movie, and start to educate them so that they can help others and help others come to a more natural way of healing, a more natural way of health. And so keep that in mind, Kathy. I imagine that Jess will talk to you about that in a little bit. But that's what we want to do because we're always trying to teach our patients to be self reliant and to figure out the things that they're allergic to, the things they got to stay away from, and how to take care of themselves. I'm going to pop up Miss Kathy's thing here. Check that out, Jess. I'll read it. I know you're driving. You're more important than anything that's out there. Why would you want to put so many poisons in your body? And that's, that has biblical reference. Your body is a temple. Um, Even if you don't believe in like organized religions, but you have a spiritual practice, most spiritual practices say, hey, this is a gift. Take care of it. Your body is your vessel, and it's the vessel that you travel through this life in. And if you don't take care of it, it's going to be a rough trip. And modern medicine, nah, take that back. Modern lifestyle has made it very, very hard. And I believe that you work with the doctors, don't you, Jess, that they want to teach and they want to do this stuff. They just can't. They're
No,
limited
they
by.
won't let them. Patients won't let them teach, and they don't want anything but a pill. They want somebody to take care of it. Well, and I'll just give you an example. Um, these are people close to me, but somebody I know had a procedure yesterday, so they had stents in their leg, and
Kathleen added the Bible. In the Bible, the word sorcery translates to pharmacology, something to think about. So, me giving my herbals is also sorcery. I need a hat. I need a wizard's hat. Go ahead. Sorry.
it's okay.
So, procedure, the
My
patient had the
glasses.
procedure.
So he went in procedure to have stents in his legs, and they're like, "Oh, were you able to get your legs, the arteries cleaned out?" And then I was talking to actually my mother, and she said, "Well," I said, "Well, you know why that happens is because they have a horrible diet." She's like, "No, no, that's not it. It's his diabetes." Well, I said, "But that's also from bad diet." And then they didn't want to talk to me anymore. But we drive the train of our own health based on what we put inside.
And don't be a slave to marketing. Pull the curtain back on the wizard and just know that television, commercials, marketing, yes, there's supposed to be truth in advertising, but they get a lot of leeway with what is truth and what is not, and what they can actually advertise and what they can't. Just as a side note, hun, I know we're kind of doing a little back and forth. I did call our rep from Microbiome Labs and told him that the powder is absolutely, it can ruin a good cup of coffee.
Well, I'm not sure what happened to our cup of coffee this morning, but yeah, this one's horrible.
Um, Interestingly enough, our in doing everything that we do, we have changed our palates, and this would probably actually be pretty palatable to people who have not gone through keto, have not changed their diets, who have not changed their palates. This would probably actually taste pretty good. Kind of tastes like a sweet tart, and a sweet tart is too tart for me anymore, too sweet. So what ends up happening is we added these to our coffees, and it is not good. And I
Just so
told
you know,
them
we're
that.
adding Kathy.
Yeah. But we added the capsules. You know, the capsules that are in the microbiome kits. Those don't have monk fruit in them. And
Well, I thought you missed something in my coffee because it was so sweet this morning. But
mm,
they could do without that.
I get it. Yeah, no, it's so I made the comment that when we start the second kit of the microbiome, then we will get your we'll actually get the capsules, and we'll take the capsules apart and do the capsules that way and see if that changes that flavor profile. So, Kathy, do you think I need to put the little wizard's hat on?
No, just the pharmaceutical company.
Absolutely. And so, getting back to the type of patient and the things that we do, our patients are very we care, and so we want to create community, and we want to have the patients actually helping each other, because the more that we can teach patients to be better, the more that they can help take their friends through these steps and take care of the things that are easy. Hey, get rid of the gluten. Hey, eat these types of things. Add more vegetables. No, keto is not a way to live. Keto is a lever to pull to get rid of blood sugar issues. Actually, it's the lever to pull to help the insulin issues. And so those are the types of things that we want to teach, to give, to do, so that people can take care of this stuff. Did you have something to say? You look confused.
I am.
So tell us where you're going and what you're doing today.
So I picked up my Kathy because I love her. And we are going to lunch, and we're going to go to the Garlina Garlic Factory, and we're going to get oil.
Did you look at the oils that we're out of? We're out of about
Yeah,
everything.
but I forgot the oil. I might just get a couple bottles, and we'll go later.
Gotcha. I can, oh, well, we're out of the bacon and the garlic and those
Butter,
types of things. Yeah.
garlic.
We're out of the staples, so I would buy doubles of those. We had the funky ones we're just not drinking. We don't even cook with them. So, and that's another thing. Following this, I'm going to do another, I'm going to make a sausage crust pizza for tonight. And these are just the things that we want to do. It's just prepping. That way you don't have to depend on the restaurants. And we are very blessed to live in an area like Columbus, Indiana, where if we want to go, if we're pressed for time, we can go to our local restaurants, and a lot of them, the Oriental restaurants will cook up some broccoli. And yeah, there's a little bit of stuff that's in there, but it's not bad. And we're to the point that our bodies can take a bit of a hit before it starts to give us funky symptoms. So,
Not mine.
we have a while shopping today, read labels. And I picked up one thing of Parmesan cheese, and the Parmesan cheese actually had, and this is part of the education process, Parmesan cheese actually had corn starch, potato starch, and these things in it that act as anti-caking agents.
Yeah,
And
you
then
have to be careful because they put cellulose in that too.
Yep. And so then I ended up getting it was a 8 or 10 year aged cheese, and it has nothing in it. It's just aged Parmigiano Reggiano, or however you say that. And there's no cellulose, no added anti-caking agents. And it's really interesting because if you shake it right next to the one that they added all the crap to, you can actually see the flecks of cheese in the good one, and the other one looks like sawdust, and that's because of the cellulose.
It is.
So I cut you off. What were you going to say?
It is sawdust.
So
I shave.
yeah, buy the shave and the aged. So I don't know
Actually,
what
they
else.
eat really good because yesterday the guy in Kroger chased me down to look at my cart.
And what's funny about that? How much did you spend in groceries?
$325.
Spent
But with all of my coupons, it was $250.
So you spent $250, and that's going to hold us over for quite some time. How much did we spend in co-pays for medications and doctor's visits and stuff like that this year?
For like sickness?
Yeah.
Nothing.
And how much have we spent?
Actually, we got off of all of our meds.
And we even got our little ones off of all of their meds, correct? Or most of them?
Yeah. All of them.
We don't
except for like rescue inhalers. The only thing we spent on is rescue inhalers and EpiPens, but they're rescue meds.
When was the last time we used a rescue inhaler?
2 years ago.
And so it works. I mean, life's not perfect. I still get the occasional rash. But let me ask, since you have Kathleen with you, let me ask her a question. What would you say the most important thing for a functional medicine patient, somebody considering functional medicine, what's one of the most important things that they should keep in mind? And I think you already kind of covered it in your comment, but we'll let you go on screen and tell them.
Well, the most important thing is yourself and your body. You can buy things and they're gone, but you can never really restore your health to where God intended it to be. Work on that through Trevor and that functional medicine thing. But you got to think about what you're doing when you're eating, preparing your food, because all that is your life, body.
And that's, I mean, when all else fails, the last thing you have, the only thing you have is yourself and your body.
That's right.
And so you better take care of it.
Yes.
And we have
And
been.
you
Go
got to listen to people like Trevor and do research yourself. You can't just go to a doctor and expect a pill to fix you.
Oh, and let me say something. I have learned a lot from Kathy because she has a condition that I have a little bit of she has taught me. And so as a doctor, I get to listen to patients and their conditions. And when I get one that's a little different, that, you know, and you have somebody that's that vested in their own health, we all learn. And it's a back and forth. And I've shared what she's given me with other patients to affect them. And it's all positive. We're all helping each other.
That's a good thing.
Yes, it is, because community is one of the 4 pillars. And the 4 pillars are sleep, nutrition, movement, and community. And community, I think, is something we all need to work on a little bit. So did you hear me talk about the escape fire viewing?
Yes.
Good. So I will let Jess talk to you about that. And we've been going for about 30 minutes now. And I think we've kind of set the stage for what a functional medicine's personality is like and kind of what we expect, because we qualify our patients. We don't take everybody, and lots of people weed themselves out just in the paperwork that comes in the beginning, because there's a lot of stuff we have to know. The timeline is very important, and that timeline can tell us is psychological stress something that affects you, or is it because you were exposed to glyphosate, or were you a C-section birth, or were you, there are lots of little things, and we get to see how the timeline goes. And then you start to see, well, what was fascinating with the last patient that we did, Jessica did the interview with, and what did you start to see in her timeline that affected her? And when you pointed it out, she had her aha moment.
Oh, it was traumatic triggers. They perfectly lined up with each group of symptoms.
And those are things that we've got to see, because we can't help you with coping mechanisms, with realizations, aha moments.
Well, traumatic triggers were things like death, divorce, like that.
And everybody gets affected by those. And so you have to have the coping mechanisms and the coping tools to do that. And that's where we are arming the functional medicine patient with that. There's not going to be a pill that takes it away. There's not going to be I've said it before, you don't have headaches because you lack acetaminophen. Your body doesn't even make acetaminophen. And think about it this way. If we were living pre 1900, well, I don't even know when acetaminophen was done. If we were living 1,000 years ago before doctors and pharmacies, A, you probably wouldn't get headaches, and B, there wouldn't be any acetaminophen around. Now, you might know to chew on some white willow bark because that seems to have some analgesic effects, but white willow bark is what we distill down to get acetaminophen. It is a Band-Aid, a patch.
It's aspirin.
Yeah, acetaminophen, white willow bark.
Acetaminophen, Tylenol.
Okay, so white willow bark is acetylsalicylic acid. Okay, so I don't know that's how much I don't use medications. I don't know the difference between Tylenol and aspirin because I don't use them ever. When we were dating and I had a headache, what did you try to give me?
Tylenol.
And what did I do?
No.
I was paying the price for a really bad glass of wine, and so I just knew I deserved the headache. But I soldiered through, did my meditation, took my supplements. You did give me something or other for nausea.
You got Zofran, but you can take peppermint oil on temples, your forehead, back of your neck, in your pulse
Wrist.
points on your wrist. That helps headache and nausea.
So, and in complete disclosure, I did take a non-narcotic pain medication when I passed my kidney stones. And that's a pain for past sins too. What was that I took? Because that's kind of the differential diagnosis.
Tramadol. And actually, tramadol is a non-narcotic that was great for pain. Most people in the hospital will pass on that. You know, that will work better because they want the Dilaudid.
Well, I puked 7 times from pain, and I was all about, hey, this is what medicine is for. This sucks, and I can't fix it, and it's just something I got to go through. What fixes this? And they had given me that tramadol, and I gladly took it. It didn't fix it. It dulled the pain. I still puked while on the tramadol, but it wasn't nearly as bad. Well, you are stationary, so you're where you ought to be. We've gone 30. Well, we've gone 33 minutes, and I think we've kind of taken care of actually probably weeding out people who don't fit the bill for who's going to be a functional medicine patient. I basically boil it down to there are leaders and there are followers, and most people who are in functional medicine and want to get healthy typically are leading their own lives. We rarely get where we want to be in health by just following somebody else's stuff. To Kathy's point, she does her own research. Also,
if you're not a self-motivator, won't get up and make your food, need somebody to put you on exercise, tell you how to do it or when to do it, probably not our person.
Nope. But we do have coaches that do help.
We do.
And people who want to change and change that dynamic about themselves. We do have the coaches that will walk you through that process. That's not my job nor my expertise.
No, you just have to be able to take control of your own life.
All right. Well, love you. You guys have fun. And
Bye-bye.
to the rest, bye, Kath. And for the rest of you out in Facebook land, if you need a functional medicine doctor, if you have questions about this, my email is right there. You are more than welcome to email me. We do have a free 20-minute consult. I will send you some paperwork that you can, and once again, that's part of the vetting process. You're not going to get better if you're not willing to do some work. So if you're not willing to go through this process of filling in the dates, filling in the timeline, because I can't tell your story. Only you can tell your story, and you have to tell your story to me so that I understand it and she understands it. And that way we can help you. Have fun.
Bye-bye.
Bye-bye. Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.